So hi, I'm Dr. Beth McDougall, and I'm in medical practice for the last 22 years in Mill Valley. And every day, patients are asking me, what can they do to prevent getting SARS-CoV-2? And that's a huge discussion, because I think there's a lot we can do to keep our immune system strong. Our immune system, our innate immune system, is the #1 tool that we have at our disposal. And it is this exquisitely complex system that's evolved over millennia. And there's things that we can do that support this system, and there's lifestyle choices we make that actually detract from the efficiency of this system. So let's really look at what we can do to augment it and try to avoid things that knock it back. So this system is so beautiful. Normally when we encounter a viral invader, we have these immune sentry cells that are roving around looking for them. And when they engulf, let's say, a viral invader, that triggers myriads of genes to be expressed within the cell, and the levels of particular intermediates are increased. And some of those intermediates are a whole family of molecules called interferons. And interferons are secreted outside of this infected cell and bind to receptors on neighboring cells, sounding the alarm that there is a viral invader. And then that puts those neighboring cells on alert and initiates a state of antiviral immunity in those cells, as well as initiates antiviral mechanisms, just myriad of antiviral mechanisms. So this is how it normally works. Now, SARS-CoV-2 has a really interesting survival advantage. It has been shown to block this critical first step in our immune response. So you've got normally the interferons being produced when a cell becomes infected with the virus. Well, unfortunately, the SARS-CoV-2, the RNA codes for a variety of proteins that block the transcription of interferon genes. So that's how it has the ability to get a foothold, and the body has a hard time sounding the alarm. So there are things that you can do that almost trick the body into thinking it's fighting a different viral invader, so that it's putting itself in a state of antiviral immunity anyway, so it's more on the alert for SARS-CoV-2, and it's able to mount an antiviral response to it. So one supplement that's been studied that can do this is beta-glucan. Beta-glucan is from the cell wall of yeast, and when it's given in the appropriate dose and cleaved to the appropriate size, it's been shown to create, oddly enough, because it is from a yeast, but create a state of enhanced antiviral immunity. And it's one of the more researched products that I've ever seen in my whole 22-year career as an integrative physician. So there's a really incredible website called betaglucan.org that compiles all of the research studies on beta-glucan, and I encourage you to check it out. Another thing we can do is take zinc. Zinc is taken up by our cells, and there is an enzyme that the SARS-CoV-2 virus needs for its replication within the cell, and it's called replicase. Zinc will block that. So taking zinc and things that will upregulate the level of zinc in the cell can diminish the replication of SARS-CoV-2. So there are a couple other things that can kind of assist with this, like quercetin. Quercetin has been considered like a zinc ionophore, which means that it can encourage the cells to take zinc up and encourage the increase in the concentration of zinc within your cells. Now, you don't want to overdo zinc. I think it's fine to take about 30 milligrams a day for prevention, but if you get sick for a few days, you can take a higher level of that and then go right back down to 30 or less per day. There's been a number of studies on vitamin D. Vitamin D it's really an interesting vitamin because it's a vitamin and it's actually a hormone, and it acts like an immune modulator. And if you have higher levels of vitamin D in your system, that's been shown to protect you from having a severe manifestation of SARS-CoV-2. So I encourage you to take vitamin D, but to go see your doctor and have your vitamin D level checked, because you can certainly take too much vitamin D and you want to watch out for that. Goal would be to get your level up to about 60 in your blood. And then there's some other things that I have found to be incredibly helpful for prevention, and then in higher doses for treatment when someone has a mild SARS-CoV-2 infection. One of those things is Andrographis. Andrographis is an herb that's widely used in Asia. It's now become frontline therapy, first-line therapy for SARS-CoV-2 in Thailand. But even before that happened, I'd been using it in a small, low level for prevention for SARS-CoV-2. And then if someone gets sick, they can really amp up the dose. And often this will accelerate the recovery. So in my busy medical practice, I can say that none of my patients have had a severe manifestation of COVID. Have had several people that have had a SARS-CoV-2 infection, probably a lower incidence of infection than the population at large, because my patients are following healthy lifestyle and taking some of my advice for taking supplements to enhance their immune system. But those that have gotten sick contact me and I give them some advice of taking these supplements in slightly higher concentrations, and usually within a few days they begin to feel better, and thankfully no one has been hospitalized.